Hi everyone, my name is Erica Diaz, and today I'm going to talk about visualizing and forecasting with COVID-19. So, just to give you guys an overview, I'm going to talk about what my objective is when it comes to this data. What did I want to do? Where did I get my data set from? The tools that I have used and the algorithms that I have used. So, you guys ever heard of smart terms such as quantum physics being used in movies to make it sound believable, whatever they're doing? Like, for example, Tony Stark used the terms eigenvalue and Mobius strips in Avengers. Not a lot of viewers would know what these words mean, but this is a technique used to make someone sound credible. And unfortunately, data is being used the same way. So, Dr. Brightsman actually did a presentation tackling bad and good visualizations, especially on the coronavirus, and some of them were created to support personal or political opinions, such as testing causing positive cases to rise. Just a myth buster, testing will not give you COVID. Like, it will tell you if you're positive or not, but it will not give you COVID. I know this for sure because I've been tested since May, and I've been getting tested twice weekly, and I've never been COVID positive ever. So my goal for today is to study COVID-19 data to avoid believing misconceptions that the media and those in power try to impose. We will learn how to interpret different visualizations, assess to see how close it is to possibly predict cases and deaths, and I'm going to do this by using visualization tools and time series prediction algorithms in Python. So why should we care about COVID? A lot of people say it's not lethal. Well, it's actually more lethal. It actually has a higher mortality rate than the flu. A lot of people think that only adults and those with pre-existing conditions are at risk, but that is not true because there are people in their 30s or 40s getting a stroke. A lot of people have lost their lives because of the COVID. We all know that. Like in New Jersey alone, there's 17,600 deaths attributed to the disease as of December 9. A lot of people lost their job, unemployment rate went down. Apparently, it has never reached this rate before, and since the Great Recession. So for my data sources, I used for worldwide data our World in Data. This is used by a lot of reliable sources like Harvard, Stanford, Cambridge. This is collected by Oxford University. For my state's data, I'm using CDC and COVID Tracking Project. COVID Tracking Project is an aggregation of data sets as well. It collects from local, state, public health authorities. This is used by Johns Hopkins. And for my worldwide data, I'm using 12/31/2019, so an earlier, but it ends at the same time as the United States data. Except for United States data, I'm using data from January 22nd. So what I did to clean my data is I removed columns, I made date formats uniform. That's most important when you're joining them on a specific column. Like for my state data, I joined the data from the two different data sets on the state and the date column, and I made the date format uniform to match them. And I filled the null values, and I changed the data types, and then I fixed a redundancy with the COVID project because it has NYC, New York City, and New York State as a separate thing, so I had to combine them. So why am I using different sets of data sets? Well, for different purposes, obviously. Like, I want to map worldwide COVID cases, and I wanted to see how we stand against other countries. But at the same time, I also wanted to focus on US data. So it's impossible for me to find a data set that has both that is not clean. So I had to do this so I can get a clean data and a raw data at the same time. So just for terminologies, confirmed cases are confirmed and probable cases. Some countries do not report probable cases. Some states do not report probable cases due to old criterias. Basically, the new criteria now is that there's more symptoms that is attributed to COVID. Deaths is just new fatalities with confirmed or probable COVID diagnosis. Testing, that's all the testing for COVID. ICU patients, hospital patients, those are patients in ICU and in the hospital that has COVID. Reproductive rate, stringency rate, stringency index, we're gonna talk more. So reproductive rate is just the average number of people each person with the disease goes on to infect. Now, not a lot of people trust these because they don't take into account those people who don't wear a mask, who goes to spread the disease in crowded areas. There's no uniform algorithm being used here, so those who derives the rate, which are the epidemiologists, they don't use the same algorithm. Also, they only represent an average across a region, so they miss clusters. Now, stringency index is the response to the number of people infected. That's the government's response. So this includes public closures, school closures, testing policies at work, travel control, face coverings. And what they do is they report a number between 1 and 100 to reflect the level of government action on topics in question. So these are just the 4 indices of stringency index. And now we're going to talk about visualization. So I use Plotly. It's very interactive. You can find it in Python and R. I tried taking advantage of the interactive format, but I couldn't make it to work in Microsoft because the add-in no longer exists. So again, total is just total per 1,000. A million or 100,000 just means I'm using the rate of 1,000,000 people or 100,000 people. Weekly smoothed, that just means instead of a daily data was aggregated over 7 days. This provides a smoother looking graph and it counts for weekends. Weekly average just means that it has been averaged for the week. So I'm presenting these data in various ways because we have seen coronavirus presented to us in a lot of ways, and oftentimes we don't really know what they mean. So I'm going to try to show that, how the different ways people have presented them. So for worldwide, we could see that cases per continent are at the most in Asia, second by Europe and North America. Now, the total number of deaths is in North America. Unfortunately, I believe it is attributed to the United States. Now, worldwide weekly increase is just the amount of new cases reported every week worldwide. So, recall how our data started on 12/31. So, since my week starts on a Monday, it went back another day to count for 12/31. So this is just for each week, all new cases are added. They are then divided by 7 to account for the number of weeks, hence averaged. Now, worldwide weekly increase per million just means that the 1 million rate is obtained by dividing the number of new cases over the number of population at that specific week and multiplying it by 1 million. The same method for 100,000, which is used for testing. For ICU and hospital, the total number of deaths at that week is used instead. Now for distribution of cases, this is just what a map of the cases would look like all over the world. So for example, if we're looking at the US, the case per million rate is 29,791.172. Now we have a current population of 328.2 million. So if you multiply those numbers, we should get that's 9,777,462 cases. That should be the total number of cases in the US. Now, the same thing for deaths. If we look at the rates in Brazil, current population in Brazil, we multiply those two numbers, we would get the total number of deaths in Brazil. Now, the testing, this is not rated per million. It's just the total. I just want to show you guys the how much testing is implemented in each country. Obviously, the US has the most. I think this is India, second, and then Russia. Now, reproductive rate per country, remember that R is just the average number of people each person with a disease goes on to infect. It is not the number of infected people walking around. Please remember that. I just want to show the highest infection rate a country ever had by plotting it like this. Now, stringency index, I wanted to show you guys the highest ever stringency index a country has ever been. So this is the strictest they have ever been, and we can see that US never reached 100, and we know why. So now looking into each country specifically, we can see that US is the highest when it comes to cases. Maybe that's related to their stringency index. And it comes to death, unfortunately, it's the US again. Now, cases per country, this is just a distribution of the total cases in each country per a million people. Now, if this was interactive, I could show you guys interactive. You could see each points on the bar graph, but unfortunately we can't with PowerPoint. And the same thing with deaths per country. Now, I want to compare United States with other countries' cases. So this would be US against other cases, including China. And if you look at China closely, it's really low. I don't know if you want to trust that. So based on this, you can see who has flattened the curve, who is about to get another wave, the second wave, who had the waves earlier, who had the waves later. And this is the stringency index that each country ever had over time, the max over time. And we can see that India was strict from week 10 to week 15, but then they became lenient over time. China has been constantly the same, became lenient, then went back up. USA has pretty much stayed the same. Now, I want to compare United States and Italy on a closer look. And this is Italy, so you see the spike in the hospitalization here, and we could say that this is because of isolation purposes. Not everyone is being discharged right away just because they feel better, they don't have symptoms, especially during the beginning of the COVID. Now with the United States, we could see how new cases seem to follow the total number of hospitalizations after about a week or two. So the more cases you have, a week or two later, you'll have more hospitalized patients. Now looking more into the US, this would be the weekly moving average of cases in the US. Recall that our data is from January 22, so to account for this, we just move it one day so that we would include, I think, never mind, it's 2 days because our week starts on Monday, so it moved back 2 days to account for 122 and start on a Monday. And this is just a weekly moving average of deaths, and you can see that we have two spikes over here for the deaths. And if we look back at the cases, we also have two spikes. So it seems that the two spikes in deaths follow from the two spikes in cases. Now, if we compare our cases, deaths, and tests, we could see that higher testing does not lead to higher numbers of cases, because you could see how much higher tests are, and cases don't even reach that number. So this is just a distribution of cases in the United States. We see that Cali, Texas, and Florida now have the most number of total cases, even if the first hotspots were in New Jersey and in New York. However, unfortunately, New York still has the most number of deaths recorded. And this is just the testing distribution. We see that California and New York has the most testing that was ever done. And this is just comparing weekly moving average of some states. So we can see that New York and New Jersey had spikes in the beginning because they were the hotspots, right? But over time, they have been doing comparatively well, unlike other states like Florida, for example. Now, just to focus on New Jersey, we could see that A spike in the number of cases was followed by a spike in deaths. You see this? It's like a weeks later. Now, time series forecast. So time series forecast, we've learned this, it's just a prediction based on the series of data points that we have over time. Just want to mention that time series uses seasonality, which is the repeating short-term cycles in the series, trend, the increasing or decreasing values in the series as well. Now, we want our time series to be stationary because in order for us to make good predictions, it has to be stationary. So COVID so far is not stationary, but we'll do our best to make it stationary. We know about the ARIMA models. Today I'm going to mention new models called the HALT models, and then I'm just going to mention machine learning models, which we all know. So for ARIMA models, we all know this, right? In Python, we can download this as the PM Dorima package. For HALT models, so HALT models uses exponential smoothing, which is weighted average of past observations with the weights decaying exponentially as observations get older. This just means that the more recent the observation, the higher the associated weight. So for HALT linear model, it builds upon a simple exponential smoothing, which is a method suitable for forecasting with no clear trend or seasonal pattern. But with HALT linear model, it adds trend to it. Now, HALT Winters model builds upon the HALT linear model but adds seasonality. Now in Python, this would be the packages from stats model, so you guys can use that. Now for machine learning models, you guys know linear regression, you know what polynomial regression is. These are all in Python. Support vector machine regressors, we all know this. This is in scikit-learn as well. So using all these, we're gonna predict data in the United States by using weekly average. So they were aggregated using the mean on a weekly basis. So this is our AR model from the ARIMA models. It's not so bad, but it's not the best. MA looks the same as the AR. Sarima almost looks similar except a bit lower. Auto ARIMA looks similar as AR and MA, and I think it is similar to AR. HALT linear is very far off, as you can see. HALT winter was really good, as you can see. Linear regression is really bad, as you can see. It's graphing it as a linear line. Polynomial regression, not so good either because it started going downhill. SVM was not so good as well. So these are just rate errors, and we could see that the lowest rate errors is HALT winters, so that's a good thing. And then AR, MA, ARIMA are not far from each other, and then there's SARIMA, SVM too, but we all saw how bad it was. So these are just the prediction outcomes of the number of cases. You can see the differences of the numbers here with that from the actual values. And for the New Jersey prediction, I did not use the machine learning models, but I just used ARIMA models and the HALT models. So after doing that, I found that for the New Jersey cases, SARIMA has the best is the best model with the lowest RMSE, and then for deaths, it was a tie between Auto ARIMA, SARIMA, and AR. And these are just the actual values if you guys want to compare. So this is just what it looks like for the cases, best prediction, and this is just the same output as the top three, well, tied at top one predictors. So conclusion, we cannot trust data without knowing what it means. We cannot trust data without knowing how to derive it. It's hard to gauge accuracy of COVID data since countries and states have different ways of reporting them. Smoothing for sure helps. Using rates per population gives us a better idea on how we're doing as a country compared to others. And if you don't believe it, you don't believe data, see it for yourself and do it, That's because not everything graphed is true. COVID is unpredictable. It seems that US as a whole has flattened the curve, but we all know that it's rising again, and higher testing, like I said, does not lead to more positive cases. We won't really know how we're doing, what we're doing wrong or great, unless we look at other countries. And for times years, it's hard to predict numbers because COVID is volatile. We don't have a trend, we don't have a lot of values on it, and we have a lot of false reporting, like China, as you guys saw. And there's this model by Facebook called Profit that I wanted to use, but I couldn't because it kept killing my kernel every single time. So, death rates are low, so let's keep it that way. Don't be the person that takes up medical resources that someone else needs more than you do, and I hope you guys stay safe. So these are just my sources, and thank you very much.